That's good. Very good. All right, what you want to do next?
I would probably go over the relationship of chronic sinus to bronchial asthma, because I see that a lot. And in those patients who have significant bronchial asthma problems and pulmonary problems, you really don't want to go give them a general anesthesia and put them to sleep because their lungs might not be that healthy. Well, you can put a balloon in the clinic and pretty much take care of the problem. And that is infinitely safer in people with bronchitis, asthma, COPD. That would be automatically the choice first.
Gotcha. So
The sicker, it's almost like the sicker you are, the more the balloon is absolutely the preferred option.
So for somebody watching who's got,
Okay, you can start.
we can use part of what you said.
Okay.
Somebody that's watching that has bronchial asthma or bronchitis, and they're going, well, I'm a little scared to be treated traditionally or whatever. Can you help them?
Absolutely. In fact, we now know, I filmed a TV special here 15 years ago where we talked about sinus bronchial asthma syndrome. There was no doubt that there's a correlation. And we did a special on this. Now the last couple of years in our field, papers are coming out about sinus bronchial asthma syndrome, and they call it the unified airway theory. Well, I was kind of looking around thinking, gee, Martin and I talked about that 15 years ago. You could see these patterns clinically. If there are patients that are having bronchial asthma symptoms and they're uncontrolled by very good doctors with excellent medicines, the first place to look is the sinuses as a trigger. Now, the worse the bronchial asthma, or if you've smoked before and you have COPD, which is, as you said, chronic bronchitis or emphysema, we know that the risk of a general anesthesia and being put to sleep and intubated goes sky high. Well, gee, to be able to take care of patients in the clinic to remove the sinus problem and allow them to use irrigations and not have to have a general anesthesia or go to a hospital, oh, that is almost the preferred procedure at that point. So it's almost like the sicker the patient is from a medical standpoint, from a general anesthesia, it is now shown that the balloon sinus dilation and irrigation is yielding similar results. And they're able to take 8 out of 10 patients who used to have sinus surgery in the hospitals or surgery centers, and we're able to help them in clinic.
So it's a no-brainer.